My name is Mikahelia, and I'm one of the registered dietitians here at Carria's Diabetes Education Program. And this is week 5 of the Healthy Plate part of our Healthy Movement Healthy Plate group. Our topic today is fluids, and we'll be discussing the importance of fluids, hydration in diabetes, how much fluids you should be drinking, and we'll also look into the carbohydrate content of a couple beverages. We'll wrap everything up by putting everything that we've learned into practice. So let's get started. Fluids may not be macro or micronutrients, but they're still very essential to life. They help to move nutrients and waste through your body, keep your blood pressure normal, protect and cushion your joints and organs, control body temperature, and lower your risk of dehydration and heat stroke. Uncontrollable thirst is one of the primary signs of having uncontrolled blood sugar levels. It's one of the body's ways of trying to compensate. It's trying to reestablish balance by diluting the sugary fluid that's flowing through your body. Your body is saying, please drink some water. This brings us to the myth about dilution. Often, people living with diabetes will drink water in response to seeing a high blood sugar level. But the truth is that this doesn't work. Yes, you might pee more, but you'll lose more water than you will sugar. It's insulin deficiency and inadequate insulin production that causes sugar in your urine. If you want better sugar levels, you need to exercise, practice balanced eating, and take your medication as prescribed. So how much fluid do you need? Well, that depends on your activity level, your size, and the weather. Most adults need between 1.7 and 2.7 liters per day. That's about 7 to 10 cups a day. However, if you're active, you'll need more than that, and if it's a hot day, you'll need even more than that. So here are some signs that you're dehydrated, meaning that you're not getting enough water. First, dry lips and dry mouth, flushed skin, headaches, dizziness and fainting, dark yellow, strong smelling urine, low blood pressure, and increased heart rate. You can get dehydrated even without these symptoms, so drink fluids often. If you find it hard to drink more water, be patient with yourself. It takes a while for the body to adjust. One way to motivate yourself is to log your progress. Document how much you drink, along with how often you pee. Soon you'll notice that you'll be able to drink a lot more without having to visit the washroom so often. To have excellent blood sugar levels long term, and to avoid having any diabetes-related complications, choose sugar-free fluids more often. It's really easy to unintentionally get too much sugar through what we're drinking. So let's take a look at some beverages and compare their carbohydrate content. Note that most of these beverages have 0 to very little nutrients. Remember from week 2 that we should aim for about 30 to 60 grams of available carbohydrate per meal? That can be very difficult to achieve if you're having sugary beverages. So keep that in mind. So instead of sharing some recipes with you, we thought it would be fun to show you the honest results of our panel doing a taste test of some sugar-free beverages that you can prepare at home. So let's get started. We're about to try 4 infused waters with our panel. And this is a great way to increase your intake of water. Just know that when you're drinking a lot of infused water or carbonated beverages, that they can have an impact on your enamel. And it might also cause some gas. Let's get started. The first one is strawberry pineapple. Okay? So pour a little sample and then toss it over.
I'm excited about this one.
So don't expect a daiquiri because it's just water, but is it good for water at least?
Cheers.
Cheers.
It's a good one.
So you can taste it.
I can taste
I
the
taste the
strawberries.
strawberries. Not
Okay.
so much the pineapple.
Okay, so we didn't put in a lot of pineapple. We could potentially put in more.
I taste a little bit. Yeah, it's good.
They work well together.
Nice. Yeah, I can mostly just, but I only have straw. Did you have pineapple in your glass? No. It's nice.
And it's good. It's not like, yeah, it tastes strawberry.
All right, one down.
Yes, that's a winner.
Thanks. All right, All right, so the next one is cucumber mint.
Oh, the mint would be nice. Yeah, this is
strawberry
what they
mint
do
probably.
at. This is what they do at St. Anne's.
Yeah, I know.
So I'm assuming this one will be more mild. We chopped up a little bit of the mint. You don't have to, but because it only sat for less than an hour, we wanted you to be able
It's
to.
nice. It's refreshing. I don't taste mint myself, but I don't know. I just taste cucumber.
Oh, I can taste a little bit of mint.
Can you?
It's not like overpowering.
It's very mild.
Okay, so good for a hot day, I guess.
Yes, that one's good.
Yeah.
I like it.
Refreshing, actually.
Yeah.
So this one, I'm realizing I probably should have put it in like a diffusing bag, like a tea bag, because there's lavender in it.
Oh.
So you're gonna get lavender in your glass. Try your best to
Exactly.
sip around. Yeah, well, that's gonna be an experiment in how well you can pour.
I'm an expert.
Good
So
job.
lavender and lemon.
I'm excited for this one.
I feel like this one might do well if you let it sit even longer, but oh, you're skilled.
Oh my god. You're welcome.
So I never used lemon.
So I'm seeing this one's a no.
Oh,
Is it sour?
No, it's
just a little bit.
too lavenderish.
Too lavenderish. Alright, so the last one is kind of, I guess you could say mojito-ish, but don't expect a mojito because we can't,
Yeah.
Not here.
can't buy rum. But mint, lime, ginger.
Oh,
ginger.
Lime ginger.
Thank you.
Now we're thinking it would be nice if you can get it carbonated, but then you wouldn't be able to let it sit.
Right,
You know, 'cause
because
the
the
bubbles,
flat.
yeah.
Right? Are there, aside from this obviously being a good way to get your waters, are there, health things in each of these, like specific things?
When it's
Sugar,
infused, you're not gonna really get much.
No,
Okay,
the health
that's
benefits.
good. I was trying not to
Yeah.
use mint,
Just
but-
in flavor.
just for flavor.
Yeah.
Yeah, I like that.
That might be my favorite.
That's
Yeah? Enjoy. See you next week.